Hi, this is Dr. Kim. Today I'd like to talk to you about 8 home remedies I would like you to try before you go see your foot doctor. And first one is, we call it the RICE: rest, ice, compression, and elevation. Just like any other injuries, we like you to rest first. Rest is easier said than done because I tell my patients to rest, and sometimes I even take them off work to stay home and rest, but they just don't rest. Sometimes I put them on a boot because they just won't rest. So resting means no gym, no workouts, no walking your dog, no cooking and cleaning. There are a lot of things that you really shouldn't be doing. You do them without any effort usually, so you think it's resting, but actually it's not resting. So I like you to really take time to rest. A lot of times I tell my patients, consider this broken. So you really need to stay off before it gets better. Then you can do whatever you want to do. So I really highly recommend you rest, and you ice it every night, about 20 minutes on and 20 minutes off. You can do that a few times. You can compress with an ace bandage, or you can elevate it. Just sit back on your couch. This is time for you to catch up on your old movies or some of the things that you couldn't do, or reading you usually cannot do. Just do it at this time. Enjoy your time off. So I really like you to do this. Very important thing. Next one, I like you to stretch. There are many different stretching techniques, but usually the steps are one of the most common thing that I recommend people. Hold on to something though. Don't try, or don't jerk around too fast, but just go down and slowly come up, and that will really stretch this area. But do it slowly. Don't cause too much pain because you're already in pain, so you don't want to aggravate it. So do a little bit of it. Do it very gently and slowly, and ease into it. Next one I like you to try is soaking. Soaking is really powerful because I like you to soak it in some kind of flowery essence, makes you feel better as well, but some essential oil like lavender or peppermint would be nice. But use Epsom salt. Use about 2 tablespoons of in a quart of water, warm water, and soak your feet 10 to 15 minutes every night, or even longer if you like. So that really soothes the area because of the magnesium sulfate on the Epsom salt. Magnesium is a relaxation mineral. Sulfate really opens up all the small arteries to circulate and get all the swelling out of this area. So it's a very effective way to improve this condition with soaking. So I like you to try that every night as well. Massaging, you can massage yourself, or if you have somebody or spouse or family members or somebody close to you, or even go get a reflexologist or even a masseuse to massage your feet. They can really work on the back of the heel area to break down the scar tissue and improve the mobility and decrease swelling at the same time. I also recommend modifying shoes. Sometimes some people take it to a shop and stretch out the back of the heel, especially if you have any bump in that area and you don't want any irritation. So some people I've seen literally cut out the back of the heel so that it doesn't irritate the area. So modify the shoes. Heel lifts. You can easily obtain this at a pharmacy. You get a heel lift that takes the tension off the tendon so that people can literally have tension off this area by lifting this whole thing up a little bit. So using lifts are very effective as well. Also, some over-the-counter medications. As a naturopathic doctor, I don't like you taking too much of this, but short course will be okay as long as you're having some food with it to try for a few days or a couple of weeks will be no problem for this as well. And also over-the-counter orthotics. There are many different brands out there. You can visit your pharmacy or even Costco to see one of those over-the-counter devices, especially if you have extreme foot type. You got a flat arch or a very high arch foot, and then you want to stabilize your feet so that it doesn't move around too much, especially on the side-to-side motion. That would stabilize the feet and decrease tension on that tendon to improve your condition. I'd like you to try these home remedies so that hopefully you don't have to go see your foot doctor. However, if you do need to go, on the next video, I'd like you to talk about how your foot doctor is going to improve your foot condition. If you like this video, please make a comment or question below so I can answer all of them accordingly.